1 in 8 women will get breast cancer in their lifetime. As we recognize Breast Cancer Awareness Month, a few of our experts want to remind you about the importance of having a breast care plan to help in breast cancer prevention. So, gather the girls, it's time for a breast exam.
Breast self-exam has had some discussion and disagreement in the past few years. The American Cancer Society continues to consider breast self-exam as an option for women. It's a way for women to familiarize themselves with their own breast tissue and hopefully be able to pick up early on a change or an abnormality in the breast. My thinking related to breast self-exam is that it's something that we should be encouraging in every woman. It's something that can be done in the privacy of one's own home. Anyone can be taught to do it properly. It requires no special equipment, and it's totally free. Many women do detect their own abnormalities, so it is important to learn to do this. Breast self-exam is a procedure done using the pads of the fingers. The soft, flat pads, not digging in with the fingernails, but using the flat pads of the fingers. 3 levels of pressure are used. A light level of pressure in small circles, a more firm pressure, and then a very firm pressure. Remembering that you are compressing the breast tissue against the chest wall. The breast self-exam is done on the opposite breast. So if you're doing your left breast, you're going to use your right hand, placing the back of your left hand against your forehead. Beginning on either the inside or the outer edge of the breast, and remembering that breast tissue goes from the center of your chest to your collarbone and over under the armpit. You want to begin in small circles, beginning at the bottom, doing light pressure, firm pressure, and a very firm pressure. Without lifting the fingers, moving upward and repeating the process, 3 levels of pressure, covering all the breast tissue. Once you reach the top, then you move slightly to the right and begin the small circles going downward.
In addition to the self-breast exam at home, we'd like women to come into their provider's office to do a clinical breast exam at least once a year. And the self-breast exam combined with a clinical breast exam will help find any knots or masses that may need to be further evaluated for breast cancer.
Hi, my name is Vicki Miller and I am one of 3 mammography technologists on staff at Marion Memorial Hospital. The other technologists are Kim Sills and Kim Beckett. I am pleased to say that I work at a facility with caring individuals who are passionate about detecting breast cancer at its earliest stage. The Memorial Health System offers many breast health care services. Marietta Memorial Hospital has 2 accredited state-of-the-art dedicated mammography units. Each unit is compared with a computer-aided detection system, also known as CAD. The CAD looks for abnormal areas and produces an alert if additional evaluation is needed. Additional evaluation may include compression views in mammography, breast MRI, breast ultrasound, or stereotactic breast biopsy. Stereotactic breast biopsy is a minimally invasive procedure that can be done under mammography or ultrasound guidance. During this procedure, tissue is taken from the breast and sent to the lab for pathology. This procedure is done in an outpatient setting where you can receive diagnosis without having to go to surgery. Another service offered through the Memorial Health System is Breast Healthcare Coordinator. Our Breast Healthcare Coordinator provides support, education, and is a link to all services offered through the Memorial Health System. Together we can fight the fight against breast cancer. Start having your yearly mammograms at the age of 40.
ideally would like to see the patient as soon as they find out they have an abnormal mammogram, or if they're doing self-exams and they detect an abnormal lump or any changes in the breast. I think the reason for that is that whenever that happens, there's a lot of anxiety associated with an abnormal mammogram, a new breast lump. Certainly patients think the worst, and they're very anxious and want to have all their questions answered. So I think we try as our group to see patients immediately, really within the same day if they want, or as soon as they want to be seen, and so that we can sit down and really go over the whole process with them. And I think once that happens, they feel a lot better about what's going on, and I think that's probably the biggest advantage to seeing us early. The first step would be, when we do evaluate the patient, is go over what we need to do as far as the lump or the abnormal mammogram. And sometimes that means additional imaging studies, sometimes that means a biopsy, which can be set up here at the hospital. Once the biopsy is done, we typically will see the patient back within 2 days, and that's when the pathology report is back, and then we would go over that in detail so that they would know the exact course of action, if surgery is required or if just observation. So typically Kim Dye, the breast cancer coordinator, will be involved with that process as well. She comes to our office and is another resource for patients as well. I think once we do know what we're dealing with, if it is breast cancer, there's a lot of options, but all the treatment options are available here at Marietta. We work closely with the oncology department with our plastic surgery colleague, Dr. Yoke, if reconstruction is required. So we really have all the modalities available here.
When it comes to fighting breast cancer, there is strength in numbers. That's why the Memorial Health System offers signature care for breast health, making life easier for breast cancer patients. And that's why we've created Girl Talk, giving you, your family, and friends a chance to discuss breast health with the experts. The Memorial Health System. Expect more.